So we're going to be talking about LEMS, Lambert Eaton myasthenia syndrome. And the thing that's important about the Lambert Eaton myasthenia syndrome is that it can look like myasthenia gravis. So it's the main thing in the differential diagnosis. However, the symptoms, the signs, the test, and the treatment are slightly different between myasthenia gravis and LEMS, the myasthenia syndrome. The symptoms in myasthenia, it can only be motor neuromuscular junction. And that means it can only be nicotinic skeletal muscle receptors. The antibodies are anti-acetylcholine receptor antibodies against that, the skeletal muscle. And that means it cannot involve the sensory system. It cannot involve the autonomic system, including your pupil. It has to be motor only. And so when you have a myasthenic patient who has autonomic dysfunction or areflexia or hyporeflexia, you should really be thinking that the target is not the nicotinic neuromuscular junction, and maybe it's some other antibody-mediated thing. And you notice if you watch the other videos on Guillain-Barré, which is also a different target and causes autonomic dysfunction. So we basically cannot have pupil involvement in myasthenia gravis. And so the signs of myasthenia gravis and LEMS for ophthalmologists are going to overlap because they both cause variability, fatigue, diplopia, ptosis, and weakness. It might cause difficulty speaking, ocular bulbar manifestations. And even though the LEMS is only 5% of the patients have ocular finding, it can have ocular finding, which means it comes to us. And so what you're going to be looking for is the autonomic dysfunction, the hyporeflexia, the areflexia, the pupil involvement, dry eye, urinary symptoms, GI symptoms, blood pressure symptoms, and that means you have to do a chart review on every patient with myasthenia gravis. When you're doing the chart review, you're looking for this autonomic dysfunction because myasthenia cannot cause that autonomic dysfunction. The test is a blood test, voltage-gated calcium channel antibody. It is a PQ antibody, less commonly the N antibody. And there's two forms, paraneoplastic and non-paraneoplastic, even though they're both autoimmune antibody mediated. And that means you have to do a full imaging study and CT of the body, because usually it's small cell carcinoma of the lung, but a full body PET scan to look for cancer. The treatment, suppress the immune system. Pyridostigmine can be used, just like myasthenia gravis, but we're not really looking for thymoma. We're looking for small cell carcinoma of the lung. And there's new drugs that target the modulation of the voltage-gated calcium channel, the potassium channel, which is also voltage-gated, amifampridine, of FDA-approved drug. So you need to know a little bit about LEMS and the distinctive feature, autonomic dysfunction, pupil involvement, test for voltage-gated calcium channel, and look for cancer.